Imagine a world where viruses rewrite the rules of life as we know it. Welcome to the world of retroviruses, microscopic entities with a knack for turning the tables on their hosts. Unlike other viruses, retroviruses utilize a unique process called reverse transcription. This process allows them to insert their genetic blueprint into the DNA of the host cell. This integration is a game changer. It essentially turns the host cell into a virus factory, churning out copies of the virus and spreading the infection. The implications of this are profound, particularly when it comes to human health. Understanding retroviruses is paramount to tackling some of the most challenging viral diseases we face. The quest to understand retroviruses has deep roots, stretching back to the early 20th century. Scientists, grappling with diseases they barely understood, began to suspect the existence of these unusual viruses. The breakthrough came in the 1980s with the identification of HIV, the retrovirus responsible for AIDS. This discovery sent shockwaves through the scientific community and marked a turning point in our understanding of these complex entities. Retroviruses are masters of disguise and deception. Their life cycle is a carefully orchestrated dance designed to infiltrate and hijack host cells. The process begins with the virus binding to specific receptors on the surface of the cell. This triggers the entry of the virus, releasing its RNA genome into the cell's cytoplasm. Once inside, the reverse transcription process kicks in, converting the viral RNA into DNA. This viral DNA then integrates into the host cell's DNA, effectively becoming part of the cell's genetic blueprint. From this strategic location, the virus can lie dormant or commandeer the cell's machinery to produce new viral proteins and assemble new viruses, spreading the infection further. Recognizing the enemy's symptoms of retroviral infections, the symptoms of a retroviral infection are as diverse as the viruses themselves. Some infections may be silent, lurking in the shadows for years before rearing their ugly heads. Others may manifest as a constellation of seemingly unrelated symptoms, making diagnosis a formidable challenge. Flu-like symptoms such as fever, fatigue, and muscle aches are common initial signs. As the infection progresses, more severe symptoms may emerge, reflecting the virus's attack on specific cell types. Diagnosis and treatment battling the invisible foe. Diagnosing a retroviral infection requires a multi-pronged approach. Blood tests are essential to detect the presence of viral antibodies or antigens, indicating exposure to the virus. Genetic testing may be employed to identify the specific type of retrovirus involved and guide treatment decisions. Treatment typically involves a combination of antiviral medications known as antiretroviral therapy, or ART. RT aims to suppress viral replication, preventing further damage to the immune system and slowing disease progression. While RT has revolutionized the management of retroviral infections, a cure remains elusive. Prevention and hope charting a healthier future. Prevention is always better than cure, and this holds true for retroviral infections. Understanding the modes of transmission is crucial. These viruses can spread through various routes, including sexual contact, blood transfusions, and from mother to child during pregnancy or breastfeeding. Public health initiatives such as promoting safe sex practices, screening blood products, and ensuring access to treatment play a pivotal role in curbing the spread of these infections. The future holds promise as research continues to unravel the complexities of retroviruses. With greater understanding comes hope for developing more effective treatments, vaccines, and perhaps one day, a cure.